Hello, this is Dr. Prashant Nirankar, working in Bidar as a consultant physician. So today we are discussing about hypertension and how to prevent hypertension and what all the risk factors are there. So it is a daily routine disease which is being routinely seen in most of the people. And so what is a blood pressure? Blood pressure is whenever a heart pumps, whatever the blood ejected is supplied or went into the blood vessels, the pressure which is created against the walls is called as a blood pressure. So that is the what one is systolic and one is diastolic. Systolic means when the heart pumps whatever the blood after contracting the heart ejected into the blood vessels, that pressure is called systolic blood pressure. And whenever the heart relaxes, that is called as a diastolic blood pressure. So whenever there are so many risk factors are there to get any blood pressure. Usually old age people are having these things because of age factor and stiffening of the arteries, and there is also any risk factor like family history. If any one father or mother is having a history of hypertension, and also the diet facts. Whenever a person is eating excess of salt, so he may also suffer from blood pressure. So any unhealthy habits or obesity is all a risk factor for the hypertension. So routinely we have to avoid all these hypertension risk factors. And stress is also one of the biggest factor which is causing an hypertension in everyone. And hypertension symptoms are very less and like very silent killer, and which can be diagnosed after regular checkup of BPs. Hmm? Routinely, whenever we very small and very less symptoms are seen whenever a hypertension is detected. Usually, hypertension is seen when BP is above 140/90. That is to be the persistent BP rise. Constantly, if BP is more than 140/90, then it is called as hypertension. And we have to lower that BP accordingly to maintain our complications or to prevent other heart complications or any kidney complications. So a very simple symptoms will be there like tiredness or fatigue or a very headache, blurring of visions. These are the mild symptoms which may occur or may not occur in some patients. And how to prevent this BP is blood pressure or hypertension. Early diagnosis and accurate BP monitoring is the main source to detect and treat the patients. So routinely, if we check BP, if we have any symptoms or not after 40 age, we have to routinely check up our BPs, and our diet also matters a lot. So how to prevent this hypertension? We have to maintain a healthy diet, like we have to eat whole grains, vegetables, green leafy vegetables, proper exercise, and we have to stop eating this saturated fatty acids. We have to avoid all these things. And whenever we are eating, we have to decrease the quantity of the salt which we are taking routinely. So excess salt may increase the BP. So diet needs some salt restrictions. And healthy exercise, meditations, all those things will help to prevent the blood pressure. So I think blood pressure is a very easy and good sign to prevent. And I think cholesterol, whatever we are eating, the oil things, we have to maintain that thing. And one more thing, what we are using is to prevent the dash is known as dietary approach to stop hypertension. So this is the diet follow, like eating less salts, and other habits like quitting smoking, alcohol consumption, everything. These healthy habits we have to gain, and we have to prevent the hypertension before getting any other complications after hypertension. So finally, I hope hypertension is a better way to avoid and understand a hypertension. is a very easy and to maintain a fit and healthy life. I hope everyone get a small uh, elaboration regarding the hypertension and how to prevent hypertension. Thank you very much.